Hello there. Welcome to EASD 2022 and to EASD TV. We're on air throughout this wonderful meeting when we all come back together again. But we're going to start with a very important set of people that I'd like to introduce you to. They are all members of the CCA, that's the Committee on Clinical Affairs at EASD, and they do something really important. They ensure, and I'm going to read this to you, that any guidelines which are produced or endorsed by the EASD are appropriate, non-contradictory, and up to date with current research findings. So let me introduce the three members here. Actually, introduce yourselves as to, because I know you're all on the committee, but you all have very particular roles. Harold, let's start with you. Who are you and what do you do on the CCA?
Well, I've been chair of the CCA for the last 7 years and will now, at the end of this year, hand over to Richard. And, what we do on the CCA, that's what you just said. There are lots of guidelines and there are also consensus statements with other scientific societies. And we oversee these guidelines and try to prevent that they contradict each other, that they are really scientifically correct and evidence-based. That's the main task that we have. And we report to the board that, of course, has the final decision.
And introduce yourself.
So I'm Richard Holtz. I'm Professor in Diabetes and Endocrinology at the University of Southampton in the UK. And it's great to be back at the EASD in person after 2 years online. It's lovely to be able to see and meet friends again. And as you heard from Harry, I'm taking over as the chair of the CCA when I'll be following his very giant footsteps to take this very important work forward into the future.
So I'm Henrik Mulder, and I'm a member of the CCA because I'm the editor-in-chief of Diabetology. That's the journal of the EASD. And many of the guidelines, the position statements, the consensus reports are eventually published, and we make sure that that's done in a proper way.
Now, there's a particularly important set of guidelines being announced at this EASD meeting. Richard, tell us a bit more about them.
So this is the joint ADA-EASD consensus report on the management of hypoglycemia and type 2 diabetes. This particular report has gone through a number of iterations over the last 15 or so years. But the reason why this year's are particularly important is that the treatment of diabetes continues to advance, and there are changes in the way that the drugs that we use to treat type 2 diabetes is occurring. I think it's particularly important because of the importance of the way these drugs have effects on heart disease and also kidney disease. And so the way that the drugs are being used has really gone through a paradigm shift over the last couple of years. And this latest update will give the very, very latest thinking on how best to use these drugs to treat people with type 2 diabetes.
And I should say that that's on Friday, so don't miss it. But Harry, what does putting these guidelines together involve?
Well, this is a structured process, and we actually have a MOU, Memorandum of Understanding, that can be found in the internet, where this structured process is described. We endorse statements, guidelines, and also consensus reports. And all steps are in this MOU. For instance, we evaluate whether it's worth to support this guideline or consensus report or statement. And if we support it, then we oversee the whole process. We will have representatives of EASD in the writing group, and they will report to us. And at the end, in the review phase, we then say, okay, we endorse it or don't. It's not completely right. We recommend to the board to endorse it or not endorse it.
And this is not a solo activity, is it? Because you partner with other organisations across the world. I mean, this particular guideline is also endorsed by the ADA, I think.
This is correct, and we have a lot of other guidelines that with other associations, and especially also with the ADA. And one of the things that we also have to look for is that our representation is equal. And especially in this guideline, it was like that. But in other guidelines, we have to really look for the fact that we have this a representation that is adequate.
Now, Hendrik, there are guidelines produced by the ton. They stacked high everywhere. How important are journals like Diabetology in getting these guidelines out to clinicians?
I think it's of great importance because the journal is sort of the window of the organization to the community, and people go to the journal to look for what's novel and what's important. And my task is to make sure that the guidelines the position statements and consensus reports that are eventually published, that they meet the criteria that we have at the journal, which means rigorous scientific assessment. For normal articles and reviews, this is done by peer review. The process with the texts that derive from the CCA's work is sometimes a little bit different. These texts may have been assessed by the CCA itself or by experts assigned by the CCA. But my task is to make sure that the scientific rigor is what we expect at Diabetology.
Now, Richard, this isn't an ivory tower exercise, is it? I mean, you have a very rigorous scientific approach, but you must also, I suspect, have a very strong emphasis on clinical practice too.
Oh, absolutely. I mean, I think one of the main motivations for me to take over the chair of the CCA is the absolute clinical relevance of these position statements and guidelines. We know that there is great changes in the way that management of both type 1 and type 2 diabetes are occurring, and we need to make sure that clinicians know what the latest evidence is and how to put this treatment into best practice. And so I think in the back of all of our minds on the committee that this is absolutely for practicing clinicians, so they know what the very latest is in terms of supporting people with diabetes to live long and healthy lives.
And Harry, we shouldn't forget that this is, of course, all about people who are living with diabetes. This is not just something that is for the clinician or the scientist, to look at and pore over. It must have really outstanding impact for those living with diabetes. How important are the guidelines coming up for people with living with diabetes?
I think they're very important. The question is always how they are followed. And there are papers that find out that a lot of physicians don't follow the guidelines, and the patients don't follow the guidelines. And this is probably due to the fact that the guidelines like this ADA EASD guideline now has a risk assessment, for instance, for cardiovascular risk. But the patient, for him, this is an abstract thing. For him, the side effects, for instance, that he has to urinate more than before, is much more important sometimes. So it's very important to have these guidelines to influence people in a way that they see their risk.
Very good.
That. I mean, of course, we know that people don't always follow guidelines, and one of the missions, I guess, of Diabetology and the EASD is to get that out into clinical practice. I think that we know that these position statements and the guidelines and the consensus reports that come through the EASD really do make a difference. We see that people are reading them. We see that the algorithms and the care pathways appear in clinical talks across the world, and we know that payers take notice of the consensus report. So, for example, last year I was involved in chairing the writing group for the Type 1 Diabetes Consensus Report, which was presented at the meeting last year. And I know for certain that that influenced the NHS England's decision to recommend the use of continuous glucose monitoring for all adults with type 1 diabetes. So there's no doubt that this is influencing not only people with diabetes and their individual clinicians, but it's also influencing policymakers and payers. That really also makes a difference to the care that can be provided for people with diabetes.
So I think all three of you have underlined just how important this particular set of guidelines is. And can I, on behalf of people living with diabetes everywhere and clinicians, actually say thank you to you all, because I know that this involves a huge amount of work by your committee to produce these guidelines. So thank you very much. And you will find that those guidelines are going to be released on Friday. Thank you so much. Bye for now.